special series Budget of Hope. Healthcare allocation and spending has been increasing steadily under Prime Minister Narendra Modi's tenure. The expectation from Budget 2024 is that much more because the National Health Policy of 2017 set a target of 2025 for healthcare expenditure to become 2.5% of the GDP. We speak to healthcare industry leaders to find out their hopes and expectations. Today, we focus on the healthcare sector, and I have with me Joint Managing Director of Apollo Hospitals, Dr. Sangeeta Reddy. Thank you so much for joining us. All the time we keep saying public health expenditure as a ratio of GDP needs to increase. Budget 2024, are you hopeful that that can happen?
Absolutely, Uma. I think it's well known that it's critical to enhance healthcare infrastructure. The burden of disease is going up. People have become a lot more aware, but non-communicable disease, that continues to grow, and therefore we need more primary healthcare centers, we need more hospital beds, we need more advanced diagnostics. In every area there's a need for enhancement and focus in the healthcare sector. I think significantly also at the same time, while we're hoping that this budgetary allocation can move closer to the 4% of GDP that we have been asking for multiple years, we're hoping that this allocation is not just an allocation, but also is effectively deployed. And that is a tax incentive for healthcare infrastructure coming up in rural environments. This is India's moment, or the moment of possibility, when we can take the potential, the data, the knowledge, the capability we have and transform it into real live world-class solutions.
One side, if you call it Bharat and India, the urban and the rural India, we have world-class infrastructure, and as you mentioned, medical tourism, people look to India for that quality healthcare. And in the other, some parts of India is probably a third world, truly third world. So how can that allocation happen? You mentioned some of those technologies. Telemedicine could be one. But how should the finance minister really look at allocating resources such that there is more equitable kind of healthcare access at least?
So, Uma, you made a great point, and that is that in our major cities, the capability of advanced healthcare exists. We have the quality, we have the infrastructure, we have the technology. Now the challenge is actually two or threefold. Number one is take it across the country, take it into rural India, for which I did mention specific tax incentives for putting up healthcare infrastructure in our district headquarters. Specific focus on primary healthcare in rural India and emergency access across the country. These need to be focused and supported. Only then will they grow to the level we need at the pace we need it, because every minute you lose in healthcare is lives lost. Additional healthcare workforce is a huge requirement and will give multi-pronged benefits across India and globally. And the third, like I said, is the research element. We must focus on innovative, made in India, new age solutions which are cutting edge. I love the Jugaad, but I want to apply Jugaad in the highest end of science.
One is the human resource availability that you spoke about, and that's a huge opportunity for India given the kind of resources that we have. Already we are struggling with NEET and the huge competition that exists. Can any budget instruments actually be used to improve that? Not just the doctors, but like you mentioned, whether all the para-health workforce as well.
So there are multiple things that could be done, Uma. I think the fact that we have great institutions, but we need so much more, and the fact that our existing doctors need to spend on enhanced learning and training. There is no tax incentive for further subspecialization. Why don't we do that? How do we double the number of, and I think the government has done a very good job in doubling the number of the medical education or the medical college seats. Now what we need to do is, number one, enhance quality in that, ensure there's research and technologies and incorporated into their syllabus in a far stronger manner so that we're bringing out future ready healthcare workers. And of course, the immediate need is nursing. The nursing numbers also, government policy was very good in that it said, let's double the numbers. However, I think we need further incentives to set up advanced schools of nursing and to set up advanced training centers. Sim labs, for example. This is the way of the future of training. There is no incentive for a sim lab. We would actually and should expect that every major hospital has a sim lab and there is a tax break for investing in sim labs. We have sent in representations and our suggestions as Apollo Hospitals. I know that FICCI has done it, Nath Health has done it, CII has probably done it as well. So we're looking forward to a positive, proactive budget which focuses on healthcare and helps us do what we do really well, which is care for people.
Okay, that's great. Just one last thing. Ayushman Bharat is something that the government is very proud of, and insurance is another big thing. Is incentivizing health insurance premium going to be one of the priorities and the push that the healthcare sector is also asking for?
So that's a fantastic point. Thank you for bringing it up, Uma. It was center stage in our recommendations that the coverage of health insurance should increase. Ayushman Bharat should be made in a manner that private hospitals can participate further, because right now for various structural problems, the participation of private is coming down. It should actually be the other way. And when I said coverage, I mean this is a fantastic time to introduce one more layer of Ayushman Bharat, which could have a co-pay element. So imagine if the middle class could pay 500 rupees and then also have an Ayushman Bharat type coverage. I'm also looking forward to the incentive which was announced for people over 70 years of age. That 5 lakh policy being rolled out will also be a significant help for the population. And there is one thing that we forgot to mention, and that is lowering input cost. Manufacturing is a huge area. So whether it's high-end equipment, which already to some level is happening, but this should be accelerated, but consumables, far more in terms of manufacturing of consumables, and then there is a policy adjustment required because the people who are manufacturing in India, for example, the gloves, yet there is dumping of gloves from outside countries, and therefore our own internal manufacturing is not looking lucrative, so you won't get more factories coming up. But I think one of the most important things is a focus on preventive healthcare. We all know that the burden of non-communicable disease is growing. The current tax write-off for investment in your health by doing a preventive health checkup is only 5,000 rupees. This is inadequate. We are recommending that this should go up to 20,000. It is important that people start looking at things like, can we do a genetic testing? If you find cancer early, then it is the most cost-effective and the least painful way to treat a cancer. So incentivizing for good preventive health checkups is actually one of the most powerful ways to strengthen not just the healthcare system, but the health of people. And therefore, 72D is the tax, which is at 5,000 rupees write-off. Our recommendation is to make that 20,000 rupees per person so that people will really invest in their own health.
So of course, that will bring down morbidity and also the healthcare costs itself for people. Finally, you also spoke about this as an opportunity for India on the global stage. That is something that I want you to expand on. How can the country use instruments to make India that kind of a favored destination, provide healthcare to the world?
So it's a fantastic question, Uma, and something that all of us feel very passionately about. There are 3 elements to this. So the first one is actually, Heal in India, medical value travel. We currently have a large number of people coming from many countries, but we need to do more. The framework in terms of our visas is cumbersome. We're not receiving people at immigration the way we could and should. We've given policy recommendations on this. This may not be a purely budget, but it is something to be viewed in a holistic manner, and we look forward to Health Ministry, Home Ministry, Tourism Ministry coming together to create a Heal in India powerful story. The second one is Heal from India. Like we were saying, the world is changing today. So if you look at devices, the Internet of Medical Things, and the fact that there is a global healthcare crisis, There is no reason why our doctors and nurses sitting in India cannot spend 3 hours or 5 hours, or if they're specially certified, dedicate their careers to monitoring global health. So a nursing home with elderly care in the United States could be overseen by doctors and nurses in India. So that is Heal from India. And the third one is Heal by India, which is really, there is a 17 million global workforce shortage. So focusing on this global workforce shortage, quickly upskilling and uptraining our people and getting a waiver on the international exams and a fast tracking on the visas as a special policy, because right now the USMLE and all these certifications take a very long time. It should actually be a shorter program because our degree should be recognized in many countries. So then you should only need to do language and a certain localization knowledge and the visa aspect. So if these are looked at, then there's a huge employment opportunity globally for healthcare workers and allied healthcare workers. I'm not talking just of doctors and nurses. You have what we call hospitalists who could be trained. There are physician assistants that we can create a whole program on. There are pharmacists and physiotherapists and respiratory therapists. So this entire aspect of allied health is a very large opportunity, not just from commercial aspect, but it is from an employment generation, from a respect for the youth, and also from a social perspective. I think this will be one more methodology for India to enhance our global diplomacy and the way we serve the world, like we did providing vaccines to the world. This is one more opportunity that exists.
Thank you so much. That's a very, very comprehensive wrap. We are here at AIG Hospitals, Hyderabad. That's part of the Asian Institute of Gastroenterology, the foremost such hospital in gastroenterology, and in fact, only one of 17 such centers in the world that's recognized as a center of excellence for gastroenterology. We speak here with the chairman and managing director, Dr. D. Nageshwar Reddy, to know his perspectives on what Union Budget 2024 should have for the healthcare sector.
There are several issues where the finances of health can be improved. The first is regarding the health industry itself. Every year, India is importing $8 billion worth of medical equipment. I think Honorable Minister should create an environment where local industries and of course with the help from external agencies, we can set up these large parks or environmental areas where medical equipment can be produced. Simultaneously, on certain very high-end areas like, for example, proton beam therapy, the government should start thinking of reducing taxes so that cancer therapy can become more widespread for our patients. Other area where I think the government should intervene is regarding the Ayushman Bharat. They have created an excellent infrastructure for these so that patients in lower middle class incomes can be helped. But I think this has to be spread out more often into other areas so that what is happening now is that the Ayushman Bharat packages are given similar to all types of hospitals. I think we should now change, and depending on the grade of the hospital, differential packages can be made. And I think this is important because ultimately the insurance that's going to make patients go for better quality of treatment. And simultaneously we should expand the range of patients who can get this type of treatment. The third area is regarding medical tourism. India has a vast potential for medical tourism. We have very high quality infrastructure, high quality of doctors. I think if the government can focus on providing help in this area, right from starting from how the patients come into the airports, visa issuance. Now fourthly, coming to medical research, I think this is an area that I would like personally the government to invest much more. We should not invest into the research which is basic, which doesn't give rise to any further output, but into translational research. Government should now identify areas of translational research and put in money or encourage this with incentives so that this can come up. Similarly, I think drug discovery research should be encouraged because this is going to help our country to initiate our own drugs. And thirdly, artificial intelligence in medical health is going to become very important. So I think if government can invest right now in artificial intelligence in healthcare, this will pay dividends in future. As a healthcare worker, these are my wishes for our Honorable Finance Minister.
We are here at the Krishna Institute of Medical Sciences, one of the largest corporate healthcare centers in the country with over 4,200 beds in about a dozen hospitals in Telangana, Andhra Pradesh and Maharashtra. We speak to Dr. Bhaskar Rao Bolineni, himself a renowned cardiothoracic surgeon and also the founder and managing director of this 20-year-old facility.
See, today we are talking about the budget. As I mean budget is whatever the money that has been allocated, has it been useful for the best of its knowledge? One. Second thing is, we always, being a growing country, we will have some concerns about the budget allotment. Usually when compared to the developed countries, the budget allotment is little lower than the developed countries. But we can able to maximum utilize the existing budget and get the full outcome of it. The PPP model, what we talking about Ayushman Bharat, with less money, you are getting the maximum benefit. Whereas in the own running hospitals, because we are not able to take into consideration the audit, what departments we are doing, we are spending more money. We should also put into the minds of the public, health insurance is a very, very important, whether we can able to make it a mandatory part of it will be supported by the government, the excess money can be supported by on their own insurance. Second important thing, nursing education if we promote, at least 1 million nurses we can able to export to the better countries where they can be self-sufficient. The other important point what we need is, we should be able to see how we can able to cut down the cost by making our own technology, make it a mandatory, our technology should be used by our own people and then send it for the export. Today, the technology manufacturing, there are so many drugs which are importing, the customs duty, that's how the pricing towards the patient is increasing. If we can able to look all these things, how we can able to make it more affordable, that will be the most important. Regarding the insurance, when we buy a car, we will do insurance. But for our own health, we can't do. Without health, you can't make a wealth. So put this into mind. Each and every person, part of it should be able to spend in their own family budget. Whatever savings that comes, first they should go to health insurance and the life insurance. Rest of the things only they can able to spend for their investment. If we are able to propagate this, put into the minds of the public, both public, government and healthcare, private and as well as the government healthcare can do wonders. There are today, you can able to mandatory make it Ayushman Bharat is compulsory in the both government and public medical colleges. The third important thing what is lacking as on today, the referral system. We have a primary healthcare center, we have a secondary healthcare center, we have a tertiary healthcare center. If we are able to put, unless the primary healthcare center doctor cannot recommend, you cannot go to the secondary healthcare. Similarly, the secondary healthcare person should be able to recommend to the tertiary healthcare. By doing that, you can able to cut down lot of expenditure on the patient side and as well as the government side. The third important thing in this country, naturally, we are talking about on a clinical grounds. Today, medical legal issues are coming. They are all going in a defensive medicine. Whenever we go for a legal thing, they look for a document. So that's why whether we require or not, we are spending more of money on the investigations for the defensive medicine. If we can able to bring all these things into the legal system and see, and then the healthcare will be different.
We are here at Yashoda, one of the biggest hospital chains in Hyderabad. We are here at the high-tech city center that boasts of being truly high-tech and one of the biggest such super specialty quaternary healthcare facilities. We chat with Dr. Pawan Gorikanti, Executive Director of Yashoda Hospitals, on what they expect from the healthcare budget of 2024.
The healthcare is one of the sunrise industries in India, I think, just like IT, pharmacy, like I think hospitals also, I think we are first world, I can say confidently. And so I think having gone throughout the world and all, providing healthcare to citizens is a complicated question like in US or UK or Africa or anywhere. So I think it should be a combination of public and private and partnership which provides best source, and even our old hospitals, like for example I did my medicine in Osmania in Hyderabad, and like many government hospitals now I have told in the last 1 or 2 years have significantly upgraded their services and facilities, including some robotic surgeries and transplants are being done now, which is kind of unimaginable when I was doing medical field. And similarly there are a lot of medical colleges have come up with a lot of beds in them too. So I think maybe a combination of public and medical colleges, and at the highest end corporate hospitals like us may be the way future forward. Our one request is if something can be done is for private health insurance, which is increasing significantly since the last few years. For example, in this hospital in high-tech city, we have almost 70% of the patients do have private health insurance. So but patients do have to pay GST for private health insurance, which is actually, if something can be done for that, benefit patients a lot. If GST abolition can be looked into private health insurance, it will benefit the patients more. And one other request is, being a sunrise industry and India being a service oriented industry like IT and all, a lot of international patients do come here because the quality of our healthcare is significantly better than anywhere else in the world. Sometimes patients having issues is visa processing and all. That is one thing, if it can be done a little hastened, it will be easier. And also flight availability from many countries is sometimes is not there, and that's why we are missing patients to Thailand and Turkey and some of these places. So if something could be looked into encouraging the healthcare providers and mostly airlines and all to put some more flights from different countries. So our healthcare services are definitely much better than them and cheaper also. So I think if we can incentivize private airlines and maybe look into GST or some kind of incentives for them to have some more flights, we can earn a lot more foreign exchange, and overall economy also it will sustain. So overall I would say that healthcare in India is progressing very well, both in the government. Nowadays government hospitals are competing with us, whatever we are doing in the top corporate hospitals and medical colleges. So maybe between a combination of government hospitals, medical colleges and corporate hospitals like us, maybe we can be the number one in healthcare in the world.
That's what the doctor ordered, the prescription of the healthcare industry leaders to Finance Minister Nirmala Sitharaman on how to keep the country wealthy by keeping everyone healthy. That's it then on this series of Budget of Hope. Thanks so much for watching.